Hello, everyone. A very good evening to all of you. Today, we have the opportunity to have with us Dr. Tarek. And Dr. Tarek is a consultant uro-oncologist and pelvic oncologist in UCLH. And he's going to share his experience with the FRCS Urology. He has recently passed his FRCS Urology in the November section 2024 exam and is going to share his FRCS journey and let us hear from Dr. Tarek. Dr. Tarek, thank you so much and many congratulations once again. Thank you for taking out time from your busy schedule and giving us time for this because everybody who is going to listen today are going to gain from your experience. This FRCS journey, we are trying to take interviews and we are going to talk to so many candidates who have appeared through this FRCS urology journey. And every experience that somebody shares is going to benefit somebody who is going to appear for this exam next. So, Dr. Tarek, welcome and thank you once again.
Thank you very much, Ankit. It's my pleasure to be with you today. And I imagine how stressful it is when you're preparing for the exam. So any piece of advice would definitely help in the preparation. So I'm very happy to be here, very happy to help my colleagues as well. And hopefully I can shed some light on some important aspects. Maybe others have, maybe they didn't really pay attention to all of it. So I hope I can help. Thank you very much for having me.
You for your time because we really need to hear from you because like everybody has a different journey because everybody somebody who is practicing in so maybe an ST7 he has a different journey, he has a different story. Somebody who is a consultant like you has a different story altogether.
Yeah.
Somebody who is doing just a subspecialty, for example, you're on, you might have a different story. Somebody who is practicing the entire urology, like he's dealing with all these subspecialties, he will have a different story. So that's why we want to talk to everyone who has been through this journey, because everybody is going to throw light on this and it's going to make it easier for the ones who is going to appear later on. So Dr. Tariq, could you please share a little bit about yourself and about your journey? When did you appear for it and how did you start
Yeah.
appearing? And was the section one?
So I came to the UK already specialized as a urologist back home in Jordan, and that was around 6 or maybe 7 years ago. And you can imagine how much long time that was since I was studying for my board exams. And then when I came to the UK, very soon after I arrived, I started my subspecialty in robotic surgery and uro-oncology. At first, I didn't have the plan to do the exam, but then I decided to do it. And that was a challenge for me to go back and recall all of the urology, especially after being subspecialized for a long time. But yeah, so the part one exam I did in July of this year, July 2024. That was also a challenge. And then I did the part two in November this year. Yeah.
So it's a very short gap between the two sections. So
Yeah.
how did you feel about the part one? Like how much time did you spend for the section one? And because you were a uro-oncologist practicing for a long time, so
Yeah.
how much time did you spend for your section one? Because you have to go back to all the subspecialties which you probably
Mhm.
not exposed for a long time.
Yeah, absolutely. So I asked some friends and colleagues how much time they needed to prepare. Some said 4 or 5 months, some said, oh, 3 months, just enough. Then I realized it's really subjective. It depends on each person. As you said, some people are practicing all of urology, general urology. They might find things easier to prepare. Some people who already, for example, did local or national board exams and now sitting the FRCS, so they find it easier to prepare. For me, I think I needed a good around 4 months of maybe 2 months of them. The first 2 months were while, going back from work and doing maybe 1 or 2 hours every day. And
Yeah,
it's important that to be consistent, to make sure even if you don't have time, do at least 30 minutes. Just
absolutely.
don't leave a gap. And then the last 2 months, I think that's where the grinding started. And then I was doing around 5 or 6 hours at least every day and spending most of the weekends, Saturday and Sunday in the library. So yeah, it was intense. Yeah.
Right. So we will be mainly talking about the section two, but just since we are talking about section one, could you please highlight
Mm.
a few resources that you used to study for section one? What do you think should be should somebody who is appearing for section one upcoming in like in the we have
Mm.
one exam coming up again in January. So
Yeah.
what would you recommend? What resources would be sufficient for them?
The most important thing is to do as many MCQs as possible. And now, since the FRCS, they moved away from the extended math questions and they're all single best answers. So just practice, just do a lot of questions. And if you are like me, who has been away from general urology, you need some resources to back up your knowledge. I relied on the Oxford Handbook. I know it's small, but it is very UK based, and it helps if you're not practicing in the UK, then it helps you understand the things that matter the most for UK consultants. And there's the Jack Donati Born. That's also a good resource. It's actually one of the new consultants who basically just published his notes, and they're very good notes. They might not be the perfect resource or the most wholesome resource, but it's sufficient to give you an idea of what they focus on in every topic.
Yeah,
Uh,
every topic I think in Donati has also included 20 to 25 questions at the end of every
Yes.
topic. So
Yeah,
that's I think
those were also helpful. You some of the questions you might not find sufficient answers for, so you have to do some research, some Googling, some checking EAU and NICE guidelines. So yeah, it's very good.
staying updated with the latest publications, latest guidelines as well. Because
Yeah, definitely. So for part one, to be honest, I didn't really check the publications per se, but I did definitely for in the guidelines. I attempted to do the Campbell review questions, and
okay.
I actually completed it all. Just it helped me to more practice because it has so many questions. However, I have to say that it is a little bit different from how it is in the FRCS. So it's if you are planning to do it or if you were ever going to do it, I know it's too long and it takes a lot of time. It's good practice, but don't rely on it as enough knowledge or practice enough for FRCS because FRCS is different and the type of questions are different.
But
So don't dwell on it too much. That's all I wanted to say.
if you are out of practice, for example, you want to go back to female urology and you have to come back,
Yeah.
then you can probably go back to Campbell and you can go through that questions and you'll get a better insight into
Exactly.
that.
Exactly.
Uh,
Yeah. So, but I mean, because this is going on record, I don't want to let people feel that you can do it without Campbell. No, it's fine. You can. For me, I needed it because I needed to refresh my knowledge on everything,
right.
and that's why I did it. But it's not really the core of the exam. It's a little bit different. So just practice on questions from different resources. There's another book that has I think 1,000 questions. Probably you know it better.
Yeah. Are you talking about Manitaria? Probably you think.
Yeah, there's the Manetaria book. It's also different from
Is one more is
the
Rafiq.
MCQ one is different.
One more is
There's
Rafiq.
Rafiq one.
Right.
Yeah, that one is good. Yeah.
Mhm. So if we were talking about the guidelines, so I have a few questions here because many of them they keep on asking, like
Mm,
guidelines are not always updated. Some of the topics from the NICE guidelines you will find they are from 2015, 2019. They're not updated over the last 1, 2 years for certain topics, for
mm,
example,
mm,
or female urology, they're not updated. So what to rely? For example, in section two or section one, whatever, should a candidate quote the AU guidelines for that because they're always updated every year? Should a candidate quote the NICE guideline? What should they do? This is a
For
confusion that only the candidates.
for part one, I don't think the latest updates make a huge difference
Right.
because they test more about the knowledge, the core knowledge of urology in every topic. So I didn't feel that being really up to date with the latest guidelines makes a huge difference. But for part two,
Right.
100%, you need the latest EAU guidelines, and you need to know where EAU and NICE guidelines differ.
Right.
or disagree on certain points. And that's because in part two, you are in a meeting with two consultants who are really updated and they know what they're talking about. They know the NICE and EAU guidelines. They're probably one of the contributors to the guidelines as well. So you can't fool them. You have to be really up to date. You have to tell the things the way they are in each guideline. And the more you back your knowledge, the more you back your answers, the more confidence you'll get, and you will be able to portray this confidence to the examiner. And
Right.
I think that is the trickiest part of the exam, that to convince the examiner that you have the correct knowledge and the confidence to say the right answers.
This is one of the very important point that you're highlighting because I find candidates, because I've taken mock exams, so I find them quoting evidences sometimes not relevant to that discussion, and that probably gives a examiner an idea. Okay, this candidate just wants to get marks, and that's why he's quoting the evidence. So I
Yeah,
think that evidence should be very spontaneous and very logical and very legitimate at that point of discussion. Then only you can
absolutely.
think about that guideline and evidence. Otherwise, just a communication, a very fluent communication between two consultants is enough to give you a pass marks. Evidences may not be necessary always to give you a good marks.
Yeah, that's true. I didn't quote too much references, but
Yeah,
I did quote it when it was necessary.
absolutely.
And it did reflect on my marks, where I quoted more evidence. And when I felt I was comfortable and confident, it did raise my mark in that specific station. Yeah.
So you appeared for section one in July and in November. So you had almost 4 to 5 months in between. So
Yeah.
what was your, how did you manage in a short time? Because most of the candidates, they spend around 6 months at least. So you had a very short time. How did you manage? What was your plan? When did you start your aggressive preparation? So what was it?
So I was lucky that I was able to do the exam in quick succession in this short time. And when you get the result of part one that you passed, for me that was end of July. So basically in August I should have started, but I felt that I have good knowledge, so I backed my knowledge really well. And now is the time to practice how to speak your knowledge, and that's something we're not used to in many cases, definitely in different subspecialties if you don't practice them. In September I started my revision, and the revising for part two is a little bit different, which is you need to have a study group where you practice and test each other. Practice I did actually in front of my phone, where I recorded myself
That's a very
giving myself a hypothetical scenario and see how I look. I have a very good mentor who gave me a very good advice once, a long time ago, actually. I'll never forget it, where he said, record yourself on the phone, obviously with the back camera, not the front camera. So don't watch yourself when you're talking, the
yeah.
back camera, and speak for 2 minutes. For example, or you're assessing one patient who's coming with whatever complaint, and say your initial assessment and stop the recording. First, look at the recording without sound. Just watch yourself speaking without the sound. Put it on mute and
Okay.
look at your facial expressions, your body language. Do you look confident? Do you look like somebody who is expert, who's speaking about something in a good manner? And then put on the sound, put away the video, just listen to it without the video. And then pay attention to the points where you're saying, for example, or something like that. You pause too much, or you're taking too long in saying a simple point. Those things you learn about yourself that you didn't know before, and then watch it with video, with sound, video and sound,
Yeah.
and see, is that the right picture? Is that how you want the examiner to see you? If you
Right.
don't like it, do it again and again, and you have enough time over 3 or 4 months to perfect it the way you want it.
Yeah, I think that's a very important strategy that you said. I think many candidates are going to start applying this from for the next exam
I
from.
hope so. It helped me a lot. It helped me a lot. I think at first I didn't like it. I was not happy. I said I wouldn't be happy for the examiners to see me this way. and I know I can do better. And that's why I started improving. And yeah, I have to say that attending courses, I attended Ankit's course. Actually, I stumbled on it in a pure chance, but I'm very, very happy that I did. Ankit, I'm not just in front of you, I said it to my colleagues. Your course is really helpful in several ways. One of them is that you challenge the candidates to feel the exam scenario. Your scenarios are also very helpful. They're very similar to the exam. And the other thing is sometimes it is as much effort you put in to find the latest updates or guidelines. Ankit has already done it. And when you come to us and challenge us for certain
Uh,
scenarios,
yeah, I
I
think,
would say I know this from certain yeah,
thank you.
but when you give me the update.
Right. So what I basically found during my preparation is I wish somebody had done this for me. So I
I
always feel that way because the same way I gave my exam in 3 months interval between my section one and section two. So again, when I was preparing for section two, I had to go through the NICE guidelines, to the EAU guidelines, to the Oxford, and then so many literature was there. And then I wish somebody had compiled them and given it to me. So that is what I've done in my course. I've tried to compile all together so that, and even after that, we always keep discussing the new references, always keep popping up. There is a never ending, the literature is never ending, but then we should be knowing which references are actually relevant for our topic of discussion. So,
Yeah.
do you really think that all publications in BGU recently or NEJM, all these journals, are they necessary for somebody has to go through in the section two, like preparation? Do they really need to emphasize a lot on the publications which are there in the NEJM or BJU, or is it enough to just
I wouldn't go straight to any GM or BJUI to search for publications. I
okay,
would first perfect my knowledge as the base knowledge, then check the guidelines. Your first go-to place would be the guidelines. For example, when you're reading the EAU guidelines, they explain the latest publications on certain things
right?
and where they were published, and they put the references as well. So if you are interested or if you have extra time, you can click on those references, go and read about them and learn more if you wanted to ace the exam, to get an 8 in that specific topic. For example, because I do a lot of uro-oncology, I was more interested to know about the very latest updates on prostate cancer, bladder cancer. So that's why I was checking them. But maybe others not as much. But just quoting the guidelines and the nice guidelines. And yeah, one more thing is the Bau's consensus statements. They're very important. At first, I felt they're too many to read, but they're actually very short publications, and they're consensus from UK specialists who are experts in certain things like the andrology
They might
and
be
the
examiners as well.
and they might be examiners. So if you quote the consensus statements,
Right.
they're very happy. They know that you know the UK way of doing things, and that's really important.
And one more thing, for example, these candidates who have appeared for the November exam, when I was taking their feedback, some of them said that they were not able to progress till the management. Some of them were saying, okay, I think I progressed till the management, but I then did not get the score I was expecting. So how do
Mm.
you think should the progression, how far should it go? Should it always go to the management and the complications, or should is it enough if you are just talking and you may not progress? So what regarding
It
progression?
is, to be honest, it is a little bit variable. I had this idea that I need to progress all the way until the end of the scenario. But for example, in few stations where obviously we were a group of 16 candidates and we had the same scenario. But my scenario, we barely reached the surgical options. But my colleague, he reached until the complications of the surgical options. I was like, wow, man, I must have done really bad. But then I got a good mark. And the reason for that, I think, the examiner has the ability and the freedom to change the scenario. And if they felt that there's one certain thing he would like to push you on or probe your knowledge, poke and see, do you know this? Do you know that? And then take extra time in the, for example, the consenting and the percentage of each complication. Or, for example, in the investigations, how would this help? Where did this come from? Where is your evidence coming from? But my colleague, they didn't bother. They asked him, okay, what do you want to do? Investigation. Okay, that's fine. This is the result. What do you want to do? Surgical options. So they progressed with him much quicker than me. But for me, they asked me a lot of details, and I think I got a good mark out of it.
So this is what I would like to highlight. Don't believe that the exam is like an OSCE format. Previously, it used to be an
It's
OSCE
not.
format that every
Yeah.
candidate will get this scenario, but it's totally different. They have multiple formats for the same scenario. They can enter anywhere, go anywhere. Don't discuss in between the breaks because the scenarios might be different for your candidate, for your colleagues.
Yeah.
There, they might get to altogether different scenario compared to your scenario. So you did not have breaks, I think. We were discussing a lot
No,
for your
no break.
exam.
No,
You did not have
no,
much breaks. However, the candidates who had on the last day, they probably had a lot of breaks.
that's
So
true.
how did you face the like? Was it difficult to do the exam without breaks? Because those who had breaks, they were also getting distracted with the breaks. So
I was really anxious about this. I thought that I would prefer to have 15, 20 minutes break between each topic, but I didn't have that chance. So I felt, okay, I have to manage with doing all of the exam in one shot. It was basically just a 15 minutes break in the middle. But the rest of the exam, I only had 5 minutes break where you barely have enough time to, you can't even go to the toilet. It's impossible. It's so quick.
yes,
And, but honestly, I think that was good for me. I managed to practice not to allow a bad station ruin the next station.
that's a very
That's
important message that
that
every.
is, I mean, I heard it a lot. A lot of people told me that. I said, yeah, yeah, that's important. But after I experienced it myself, and I saw a colleague next to me who was so devastated about one station, and I was trying to help him, I was telling him, please forget it. It's not important. Whatever you get, don't worry, move on. And the most important point is that the next examiner, they don't know you. They don't know. Maybe you are an eight student, or you could be a five or a four. So don't let them see that you are not confident.
Right.
Actually, show them that you are confident. Even if fake it, show that you are very confident in this topic, even though you don't practice it. Just you prepared well, you can do it. Just be convincing the way you talk. Don't let other stations ruin your chance.
So what's your other suggestions like confidence, right? That's the key. But then it has to be with knowledge, like the confidence. You
You
what?
can't get confidence without knowledge.
What's your other exam day suggestions? Like be confident, and what else should a candidate do on?
Um, uh, I think if you so back yourself up with good knowledge, be confident in the exam, and try and be as relaxed as possible. I was so stressed before the exam, but my exam was in the afternoon, so I had that morning. I in the hotel. I booked a breakfast. I had a breakfast. I had a shower. I got dressed. I felt I was feeling better already. And when I reached the exam and you see your friends, your colleagues there, everyone in the same boat as you, so you also relax a little bit. You don't feel like you're alone in the world. Everyone is the same.
Right.
So even the examiners, they've been through this and they know it is stressful.
Yeah.
So just try and relax.
Once you
Um,
get into the momentum of the exam, you forget the stress, I think. Once the exam starts, you don't have time to get stressed.
Definitely. Yeah. In the first second when you arrive, you forget about everything.
Yeah.
You have to just focus on what you know and what you're planning to say. I think my first station was in stones and infections,
Mm.
and that was my highest mark actually.
Oh,
Because I felt I was ready. I made sure I'm ready to speak about stones and infections. I quoted the right literature. Yeah, and the most important thing as well, try to speak to the examiners as consultants in your department. For example, my scenario was for example, to talk about a patient and how would you manage this patient. So I was trying to explain how would I do it in my department, how to deal with it. I would go see him, the patient in A&E. Okay, but then what about investigations? You'll say, okay, after I stabilize this patient in A&E, then I will plan more invasive investigations later on. So it's you have to live the scenario,
Exactly. Yeah.
like
Be
it's
less theoretical, be more
through
practical.
practice. How would you do it?
Be
If
more
it doesn't make sense in your practice, just don't say it. It doesn't make sense to the examiner as well.
Absolutely. Be more practical than theoretical. Okay, guidelines are there, but guidelines are not real lines. You cannot be just very rigid with the guidelines and just follow them blindly and forget about what is possible in your setup or not.
Yes.
So you said about this, like you started with stones and infections, and then you had probably the BPH andrology, and that's how the sequence progress. So one thing I would like to highlight regarding the preparation strategy, I think we have discussed that also previously. When in the last 1 week or over the last 2 weeks before exam, we should
Mhm.
try to prepare in that sequence only. For example, we should start preparing from stones infections and keep in mind that our next station will be BPH andrology or female functional, and then so we should prepare in that strategy so that our brain gets accustomed to this sequence, the way we are going to answer in the exam. Uh,
Yes.
I think we had a mock exam before the exam also in that sequence. So
Yes.
I think that's something very important. We should be emphasizing the sequence is important. You
Yeah,
have
it's
how to
important to learn the sequence. And when you do your studying, your exam, your mock exams, always be ready that after stones, I'm going to talk about this. After that, I'll talk about that. And so in some way, you're putting a sequence in your head that you are ready to talk about things in a certain sequence, and that does help. Actually, it does very much.
So you appear for many mock exams. How do you think the mock exams, like, is it mandatory everybody should go through the mock exams, or just practicing with the group, is it enough for the
No, no,
candidate?
no. I think mock exams are really important. Practicing with the group is also very important, but you have to test your practicing in the mock exam. And when you go to a mock course or mock exam, you have to deal with it as if it is the real exam.
Right.
I did a mock test with you as well. I passed that one. So these scenarios, they will give you confidence and they will prime you to the exam, make you fully ready for the exam.
Better that we make mistakes in the mock exams than
Oh, yes, definitely. Yeah.
yeah, every mock exam teaches us something different. Definitely. I think
Yes.
everybody who goes for a mock exam definitely ends up learning something that he's lacking into and gains from the exam always. So we have discussed a lot about the resources. You said about the AU guidelines, the NICE guidelines,
Mhm.
about the courses, and could you tell me any like what any books that a candidate should can read apart from Oxford and apart from the guidelines? Is there any other books sources that a candidate should?
I read the Jack Donati. I just revised it again for part two. It didn't take me too long. It's short two-part books. I revised there are, the Procar book. I know it's very old, but at the end of the book, there are some nice scenarios. They're very similar to the exam as well. So I basically just revised the end of the book, the five sessions scenarios. What else did I revise? Yeah, I mean, a colleague of mine, he shared his notes. I reviewed them as well. But after that, it's just practice, practice all the time. You can't stop practicing, and I cannot stress that enough. The study group is so important, and make it a small group. At first, we had a group of 10 people, which was wrong.
Thing.
That was not helpful. We did a couple of sessions where you do one scenario in 3 hours, and that's not good. You need to be two, maximum three,
Right.
where one is testing, one is the examiner, one is the examinee, and then switch every 10 minutes. You have a new scenario. That's how it should be.
I think that's very important. If you discuss in a group of 10, that's not going to be, nobody's going to learn. I think that's discussion, everybody's going to give his opinion, and it becomes a lecture on a topic rather than a practice session. So for section 2, practice is the key. For
Yeah,
section 1, knowledge is the key. So
absolutely.
when you keep a duration between section 1 and section 2 less, it becomes easy for your section 2, because all that you have to do is just revise the knowledge that you already have. That is what I
Exactly.
been recommended for the last July batch, that try to appear for the section 2 as early as possible, because the knowledge gets old, you start forgetting the knowledge, and then you have to
Mhm.
emphasize both on the knowledge and your practice.
Absolutely. So use your notes and your books from section one to prepare to refresh your knowledge for section two, and then go ahead and practice and review the latest guidelines and consensus statements.
Candidates who were preparing for section 1, they sometimes they don't have any idea about the section 2 exam, how is it being conducted, what are the stations there. But then I believe the candidate who are appearing for section 1, they should have idea about the format of section 2 as well, so that they can frame their notes accordingly, because the notes have to be framed in sections like stones and infections together, BPH andrology together.
Yeah,
So I would request even the section 1 candidates to frame their notes in subgroups, so that
yeah.
when you start preparing for section 2, you don't have to make absolutely new notes. You have your notes, you can just add a few points if you want.
Okay. Yeah, I didn't know you at the time, so I didn't know that advice. I didn't do that, obviously. But yeah, I can imagine that would be super helpful.
Yeah, so even that we are doing right now with the section 1 who are appearing in January, and I'm sure that they are going to benefit when they appear in May or November next year. They're going to
Yeah.
already ready notes. So,
Yeah, definitely. I can imagine how that would be so helpful. I wish I did that. Yeah.
okay, Dr. Tarek, the last your golden advice for the upcoming May exam.
For the upcoming May exam, revise really well, practice really well. FRCS is not a sprint, it's a marathon. So study every day a little bit. Every day do some practice, improve your approach. Maybe if you don't speak, if English is not your first language, improve your vocabulary. Know the words that are appropriate to say in certain things. If you get a scenario that is completely out of the blue, you have no idea what it is, just stay calm, follow the ABCs, follow the what would you do if you get this weird scenario in A&E? How would you manage? Stabilize the patient, you do what's right, and just relax, just relax. The examiner will know that this is an unusual scenario. So they will appreciate that. And even in the exam, the director of the exam, he said, in rare scenarios, the threshold for a good mark is very low. So
Right,
just be safe. Just be safe. We will give you the pass mark.
right,
But if it was a very common scenario and easy scenario, you have to be spot on to get you the pass mark.
right. And
So don't worry if you get a difficult scenario. It's actually maybe easier to get a good mark in that one.
yeah,
So and in the practice courses, when I felt I didn't do well, there were so many questions I didn't know. The examiner in the mock course, they gave me a good mark. But when I felt I did very well, I thought, oh, maybe I get a good pass. They barely failed me. So it's not what you think. The mark is not always what you think you're gonna get. So stay calm, relax during the exam. Don't worry about the marks. It's just a conversation.
a lot of parameters on which a candidate is marked. It's not just based on knowledge. It's based on your based on how calm you are, how well you are presentable, how well you can
Yes.
express yourself, and how safe you are. That's the most important. So
You,
when you
you
get
you
an
need to imagine that those examiners, they are FRCS holders and they want to invite you to become one of them. So they want to see that you are a consultant level, FRCS worthy, the way you talk, the way you present yourself, you look like a UK consultant. And you know this standard is not easy for them. So yeah, just speak in a way that you are confident, that you know what you're talking about. You should be fine.
Okay, I think everything that you said, Dr. Tarek, I think everybody who is going to appear for the exam, starting from the resources, starting from the exam day preparation, from the section 1, your FRCS journey, whatever you share, everything is going to be beneficial for the candidates who are appearing in the upcoming exams. So thank you so much again for your valuable time. I know you're busy, and you just passed your exam yesterday. You must be celebrating as well. I just got a catch of your time. Thank you so
No worries, no worries. It's my pleasure. And if you or anyone would like anything else or any advice, feel free to contact me through Ankit, or you will find me on social media, and I'm very happy to help if I can.
Sure. So we will be keeping in touch with you and we will
Oh, definitely, definitely.
in your advices as well. Okay. Thank you so much once again for your time. Thank you.
No, thank you for having me. Appreciate you.
Thank you. Thank you.
Bye.